Good morning. My name is Dr. Boris Markewych. I've been practicing in Spokane, Washington since 1987. I have been using the HyProCure implants for approximately 3 years and have been an Atlas member for a good year. So I'm a HyProCure victim. I have a size 5 HyProCure implant in my left ankle. Understand, please, that I am 60 years old. Back in the early 80s, I had a ski accident and basically had a ankle or knee arthroscopic procedure to remove most of the medial meniscus. As a young adult and an adult through life, I'm a big skier from the age of 4. I played competitive soccer through grade school and high school. I moved out west from Chicago and started backpacking, eventually turned into a climber, a rock climber, a ice climber. Just basically have abused my body in a great way through these outdoor activities. So fast forward now to the age of about 55, skiing with the left knee being bone on the medial aspect became a problem with pain. It was difficult to walk stairs. I was walking one step at a time. I had difficulty getting out of my car. Once I went to my mechanic and he saw me getting out and he said, "You look like you're an old man trying to get out of that car." I basically was determined to have a knee replacement, went to see 2 orthopedic surgeons in Spokane. They both asked me or told me to come back when it hurt me more. Neither one of them asked me about my quality of life. At that point, my kids were entering teenagehood. I couldn't hike with them. I couldn't participate in activities that required running or biking with them. So in the process, a physician for the University of Washington football team came into my life and basically did 2 plasma injections into my left knee. And that basically didn't take the pain away, but calmed the pain down so that I can continue on skiing and just walking. I couldn't still ride a bike or run or anything like that, but it just cut the pain so that I can continue on with work, my passion of skiing, and have a little bit more quality time with my family. Fast forward to last ski season, the knee started bothering me again. Basically, it's bone on bone with a lot of spurring around my knee joint. My lower limb, the tibia bone, was developing a varus deformity on the distal aspect, and the pain was increasing. I was seeking some type of solution. Went down to Cancun to the Gramatica HyProCure seminar, and they were talking about runner's knee. Somebody was lecturing about runner's knee. I think it was Dr. Graham himself. And as I was listening to this lecture, I saw nothing but my knee on the PowerPoint presentation. Proceeded to think about it. And so understand I have a rectus foot structure, no flat foot syndrome, but with the tibial varus, the knee on the medial aspect was just grinding. I flew to Chicago, the end of June, did a pre-op x-ray of my knee on Saturday of that weekend. It was bone on bone. Had Dr. On perform the surgery on Monday morning. 30 minutes afterwards, we did a post-op x-ray. There was a gap between my 2 bones in my knee joint for the first time. And for the first time after 30 minutes of the procedure, I was pain-free with my knee. Standing there, I actually couldn't feel my knee for the first time in who knows how many years. It was a wonderful feeling. I since then got on a plane that evening, went back to Spokane, went back to work the next day with crutches and a can walker, stayed in the cam walker religiously for 2 weeks with the crutches, transitioned to a shoe at that point. During those first 2 weeks, I took 2 hydrocodone pain pills. Otherwise, there was very little discomfort, and have been pain-free with my knee for 5 months now. I've lost weight. I basically have fixed my bike for the first time in 5, 6, 7 years and started riding my bike. And I'm really looking forward to the ski season to see if I can actually ski without any knee pain. So I'm a walking proof that the HyProCure implant was life-changing for me. I wake up every day wondering if my knee will start hurting the next day, and I'm thankful that every day so far it's been pain-free. Now, will it last forever? I have no clue because I'm still believing there's no medial meniscus in my knee. But the fact that my quality of life has improved, and hopefully it'll last for many years so that I don't have to do a total knee implant, because after doing more research on that, there is no other option once you enter that tunnel.